class, Betsy here. I wanted to make a home video here on how to wrap an instrument so we can process it via the autoclave to get it sterilized for a procedure. Granted, I am working from home during this COVID crisis, so I'm just working with instruments and supplies I have around my home. So when we autoclave, we can autoclave with a lot of different kinds of material. Okay, you can use muslin paper, like in your book, sterilization pouches, cloths, towels, OR towels. They're usually blue, so that's why I chose this one. I chose a blue towel. And I also chose this one because it has a different kind of mesh or color on the other side, so you can see how I fold things. Okay, so we're gonna pretend that this is what I'm gonna wrap my instrument in. Ready? And today we are going to wrap a type of hemostat here. Here is its ratchet part right there. So that's the part that hinges together. You're going to hear that locking mechanism. Okay, right? And when we autoclave, we want the ratchet to be open. Okay, some people even want it all the way open. It does depend where you work on how they want their instruments to be processed. The goal of sterilization is to make sure that the equipment is sterilized and that when it comes time to open the package that we can do so in an aseptic way to keep our sterile technique, right? To not compromise the field or our patients, okay? So a lot of people do it a little different, add maybe their own flair, their signature, but the main thing to remember is if it's able to be opened in an aseptic way. So this is my way. I'm sure there's many different ways, but we're gonna do it this way tonight. Okay, so what I usually do is I've made sure that my instrument has been properly disinfected, cleaned, usually with some kind of enzymatic product that will eat away any cholesterol or fat deposits, blood. Before I actually package my instrument, I like to inspect it, make sure there's like nothing in there in the nook and crannies of the instrument. This is an older instrument, so you're gonna see a little rust on here. Again, this is from my home. You can get like microscopic scratches on the instrument where bacteria like to harbor and grow. So this is why you want to brush it with nylon bristles in where you have rough patches or the hinges, again, the ratchets. We have a textured base here. The serrated edges is what we call it, okay? So open in the ratchet, and it does have a curve. Okay, this is a curved hemostat. And I like that curve up so it doesn't accidentally perforate the pouch because it might be paper, okay? So I usually start off with a square. I like to turn this square and I turn it towards me and I kind of turn it into a diamond. Okay, so I'm gonna place the instrument directly in the middle of the diamond. I want it completely centered. Ready? I am gonna put my makeshift indicator strip here. Okay, it's just a piece of paper for today with today's date on it, and I'm gonna put it under there. Some offices or places will actually like their tips of their instruments covered with either gauze or maybe silicone autoclave safe tip protector, again, to protect the tip of the instrument, but also keep it from perforating the pack. But we're not gonna do that today because this is just what I have. Okay, so we're gonna put it in the middle. The next thing you're gonna do is I like to always make sure that my handles are pointing towards me, and then I'm gonna start at the bottom. And I'm gonna fold up, okay? I'm gonna hopefully be able to cover that instrument tip, okay? Make sure you have everything kind of like that. And then you're gonna kind of fold that corner, the tip down a little bit. See that difference from this to this? And the reason for that, hopefully it stays down, is remember we're gonna open it, we have to pull it open, okay? So it's not wanting to stay for us. Let me flip it the other way really quick. Hopefully it'll stay that way. Oh, where's my indicator strip? There it is. Okay, sorry about that. So here we go. I'll try that again. It's a little bit better. Okay, so we did that part, and you can hold it. So we started from the bottom, and now we're gonna hold the instrument right in the center, and then you're gonna bring one side over. Again, covering the instrument, and then fold it back. Keep inside your square Okay, because if you do this, you're gonna have flaps kind of sticking out. So just kind of go like that. Kind of get a different view of it from the top. Okay, so this is where we started. And then now we're going to the side. Okay, now start from the bottom and then go side to side. It does not matter which side you do first. Okay, I'm just doing this side for some reason. And then you're gonna fold, stay within your space. And then I'm gonna grab the other side, holding my instrument because you want it nice and snug in there. You don't want it loosey-goosey. You're gonna come in again and you're gonna fold that tab this way. Again, you want those tabs because this is how we're gonna open the package. Okay, so now that we have the last flap, this is where we can get fancy. Some people can just close it and have edges coming out like that, or some people kind of like to kind of bring in the edges a little bit more and bring it closed that way. Okay, so bear with me. Again, we're working from home here. Some people, there's a lot of different things you can do here. So as long as your instrument is secure in there, you'll be okay. All right, I'm pretty kind of type A when it comes to my wrapping. I don't like any edges sticking out, right? So this is how I'm gonna close it. Remember, I wanna show the person, whoever's gonna open it, to be able to pull it open. Then you're gonna grab your autoclave tape and close this. Okay, so for the sake of today, I have just orange tape. Just gonna make sure this is nice and snug. Don't want that corner sticking out. And we're gonna fold, okay? And we're gonna just tape across. We're gonna act like this is autoclave tape. And you wanna secure it. You wanna secure it for where you have that tab. And if you wanna add a little bit more tape, add a little bit more tape. The point here is to secure the package inside and secure the closure. That way, if you grab it from any which way, it's not gonna fall apart, okay? Doesn't have to be super fancy. This is just what we're dealing with today. Ready? Then you're going to get a Sharpie and you're gonna write on the package what it is. So we did a hemostat, so you're gonna put like hemostat, okay? And then you're gonna put today's date, because we want the date of sterility. So it's not the 420, it's 415. We're just gonna put it up there for today. And then you're gonna have your initials or signature of who did the package. Okay, so this is totally like, at home, makeshift amateur hour, but I wanted to kind of at least show you what it kind of looks like, okay? Now, let's pretend we already autoclaved that. Just really quick disclaimer, I like to use markers to label my packages because a pen sometimes will perforate a package, and remember, we don't want any holes. So let's just say that it's time for a procedure and our provider needs this instrument. So what we're gonna do is we're going to break the tape, okay, carefully, or you can take off the tape, however you're gonna do it. So today we're just gonna take it off, and you're gonna start to open it. And you're gonna start to open it by pulling the tab. So I'm gonna see if I can kind of move the camera up a little bit so you can kind of see what I'm doing. So I'm holding the package. I can feel the instrument. I can feel the handle. So I'm securing the instrument in my hand with kind of force so I don't accidentally drop it, okay? And then we're gonna open these tabs away from us. Okay, there's the first tab. And if you can kind of grab it with your fingers. You don't have to, that's a little bit more advanced, but okay, so kind of get it out of your way. Still securing the instrument, kind of hold it down again, and now you're gonna get the other tab. Pull and hold. I like to kind of hold the edges, and you can just kind of schnook them in your fingers there, because when we drop it on the field, sometimes these edges can contaminate the field. Again, a little bit more advanced, but if you can do it, great. So we're gonna pull that, just put it in there however you can. There's no fancy way to do it. And I can still feel the instrument. So I'm gonna kind of come back here, switch hand even. Next tab, pull, open. So now we're getting to the inside. So here's the last tab, pull, and oh, there's our instrument, okay? Pull without touching the instrument. Now you can either hand it to the provider and they can grab it, or if we wanted to throw it on the field, we would just carefully put it on there, not touching the sterile field. okay? So sorry this is so amateur, but at least it's something for you to kind of look at. Thanks for watching.